Susan is a 28-year-old female who has been experiencing progressively worsening low back and buttock pain for the past 2 years. The pain began after her son was born. Susan's pain increases when walking and sitting, and decreases when lying down. She was diagnosed with sacroiliac joint dysfunction. Sacroiliac joint dysfunction is a lower back and pelvic condition which causes pain due to hypermobility or hypomobility in the sacroiliac joints of the pelvic bone. Hypermobility occurs when the joint and ligaments become loose, which increases abnormal movement within the sacroiliac joint. Hypomobility is the reduction of movement within the sacroiliac joint, which causes it to become tense and tight. Pregnancy is one of the main causes of sacroiliac joint dysfunction. When giving birth, the joints of the pelvis become more elastic in order for the child to be pushed out. This elasticity or hypermobility creates the pain associated with this dysfunction. Sacroiliac joint disorders can also be difficult to diagnose due to the many spinal structures surrounding the joint. These spinal structures can cause the pain to be centered around the joint itself, which allows examiners to believe that the location of the pain. Therefore, careful diagnosis of the joint is necessary. In order to diagnose the sacroiliac joint dysfunction, different methods are used. Anterior and posterior gapping tests are also commonly used to diagnose this dysfunction. During this test, the examiner will apply pressure to the joint. The purpose is to cause pain and further reveal symptoms. The sacroiliac joint is a true diarthrodal joint with unique characteristics not typically found in other diarthrodal joints. The joint differs from others in that it has fibrocartilage in addition to hyaline cartilage. Innervation to this joint consists of the innervation of surrounding muscles such as rectus femoris, gluteus maximus and minimus, latissimus dorsi, and iliacus. The nerves involved would be the femoral nerve, inferior gluteal nerve, superior gluteal nerve, and ventral rami. It can be difficult to diagnose problems arising from the sacroiliac joint because there are so many other conditions that can cause similar symptoms. Doctors must rule out disorders affecting nearby structures such as a herniated disc, ankylosing spondylitis, or Facet syndrome. A herniated disc occurs when the fluid of the nucleus in the spinal disc is pushed out into the spinal canal. Common symptoms include arm or leg pain, numbness and tingling, and weakness. This was ruled out due to Susan not experiencing any numbness, tingling, or weakness. Her pain is localized in her low back and buttock area. Ankylosing spondylitis is a vertebral and sacroiliac joint chronic arthritis where synovial joints become inflamed. Severe cases can cause chronic pain, discomfort, and possible spinal fusion. This form of arthritis was ruled out due to Susan's pregnancy, which seemed to cause the low back pain. Prior to being pregnant, Susan was healthy and regularly active and had no evidence of chronic arthritis. Ankylosing spondylitis has also a genetic component, and symptoms usually appear in early adolescence around the age of 17. It is unlikely that Susan would begin experiencing symptoms in her late 20s. Facet syndrome is an arthritic and inflammatory condition which causes pain in the facet joints. Facet syndrome is typically localized in the cervical region, leading to neck and back pain. Typically, this is caused by trauma such as whiplash and car accidents. This condition was ruled out due to Susan's pain being most severe when walking or sitting for any length of time. Her back pain is reduced when in a laying down position. Patients with Facet syndrome tend to feel more pain when lying down and sleeping due to muscles in the back relaxing. When these muscles are relaxed, they tend to grind together and cause severe pain. There are multiple courses of treatment to combat and help alleviate the symptoms of sacroiliac joint dysfunction. One of the main approaches is seeing a physical therapist, chiropractor, or osteopathic doctor. A physical therapist can do manual therapy, flexibility, and strengthening exercises. Pelvic braces and supports can also be prescribed to help reduce the inflammation and pain. There are also exercises one can do at home to gently move the SI joint and increase mobility. Most stretches target the anterior and posterior thigh, specifically the gluteal muscles, the hamstring, and quadriceps. These muscles are important to stretch and strengthen because they originate at the sacrum, ilium, or ischium. The sacroiliac joint connects the sacrum to the iliac bone, which is where the SI joint dysfunction stems from. Strengthening these muscles aid in the mobility and proper functioning of the SI joint. Over-the-counter medication is an option one can utilize to help with the pain. Ibuprofen is a well-known medication that can be taken. Prescribed medications such as muscle relaxers and narcotic painkillers are also used. In other cases, there is a possibility of getting an injection, which is a combination of lidocaine and an anti-inflammatory medication like a corticosteroid. This is to help reduce pain. Typically, this treatment method is used while working with a health professional to re-stabilize the joint. With a diagnosis like sacroiliac joint dysfunction, treatment depends on the patient themselves. Normally, multiple approaches are used to help combat the symptoms. Emerging treatment techniques include prolotherapy, which is an injection technique that introduces a small amount of an irritant solution to painful joint spaces, ligaments, or tendon insertions. This is to promote growth of normal cells. Another option is platelet-rich plasma injections from the patient's own blood, which would also promote growth. This method lacks studies, but seems to promote pain relief and functional improvement over a corticosteroid injection. The last could be peripheral nerve stimulation, where in one study it was shown that they had implanted a neurostimulation electrode and administered stimulation for up to 7 days. 86% of the patients in a particular study reported improvement of lower back pain within a year. With following a treatment regimen to strengthen her lower abdomen, Susan should be able to live a healthy and active lifestyle. Susan's case can be used in the future to help develop a diagnostic tool to differentiate between the similar conditions that were considered for her case. This would allow a more rapid diagnosis. Her case could also be used to develop a treatment regimen for women similar to her.